Yeah, it's been a year of lockdown, and of course, COVID-19 has affected our health. Many have lost loved ones. Looking there in that insert at the economy, how it's affected our pockets. It's also affected our minds. To look at the psychological impact of lockdown, we're joined by the president of the Pan-African Psychology Union, Dr. Sachs Cooper. Dr. Cooper, thank you for being with us. Let's start. I mean, a year ago, there was uncertainty. Now, maybe with more certainty, you can tell us, what are the mental health manifestations of COVID-19?
Well, periods like this do give rise to serious consequences for individuals, for families, for communities. And this is something that has impacted people all over the world. As we just saw, the compassion that exists amongst some of us is boundless, and that during periods like this of serious despair shows the best in us rather than some of the worst that we've already been subjected to. There's a depression, there's consequences for people who have lost jobs or don't know what's going to happen in terms of the next day, the next meal that's going to be put on the table. And I think that it impacts on the overwhelming majority of South Africans. So there's a huge degree of insecurity and uncertainty about what tomorrow will bring. People are living on the edge, and most of us, and probably some of our viewers out there, don't understand probably the depth to which people have been hit by this pandemic, and the lack of taking care of the mind, the psychological and emotional well-being is very serious. Remember that we've not had a priority in terms of mental health in this country anyway, and COVID has increased that. There's been a fatigue in terms of many, many areas. Isolation, for instance, is something totally unnatural for human beings. We are social. We are gregarious. We tend to interact and thrive with interaction with other people. A very small percentage of us can do with isolation. The majority cannot. Then there's the losses that most of the people have experienced in terms of their livelihood, in terms of usual engagements in society, and then for the people that they have lost to COVID. There's also the stigma issues that haven't been completely erased, even though serious leadership have been impacted by it. Just last week, we commemorated the passing on of the Zulu monarch. So people have been impacted by it, and we've not dealt with the grief and the inability to seriously mourn because of restrictions. All of that tells us that the conditions that we have been subjected to in order to preserve us being infected does take a toll. Yeah. But there's no respite for it because there isn't help out there except for those few helplines and what people are doing in terms of helping each other. The impact on children is very serious as well.
So these conditions, I mean, you're painting a bleak picture. It adds to the insert that we looked at around the economy. Conditions that make people desperate. From an economic perspective, I remember one economist saying at a certain point of unemployment, you don't have a viable society. You have this huge potential for instability. Do you worry about social unrest in South Africa?
Well, if it weren't for some of the lockdown and related restrictions, we would have had people on the streets a long time ago. And particularly with the poor, bad, and extremely bad examples set by people in leadership in different sectors, the way they carry on, the way they, the pandemic profiteers, Francis. I mean, in a time when people are in serious need, we've seen a few who are responsible for meeting the challenges that COVID has presented us with, abusing that trust. So there's a despair. People are also not willing to comply with certain regulations like mask wearing. One, most people can't afford wearing a throwaway mask. Secondly, there's no enforcement around, and when there is enforcement, it tends to hit the news for all the wrong reasons. So this period has not engendered a spirit of cooperation, a spirit of self-reliance and reliance on others to get us through this. There's been a rise in extreme selfishness, people only looking after themselves rather than worrying about those around them, and our children, who have been most vulnerable and most impacted, have not been dealt with at all.
Yeah.
They are there, they pick up our anxieties and everything else. And I'm pretty certain that we're going to see certain clingy behavior, certain anxieties, indeed certain extreme vigilance and watchfulness that children are going to exhibit because of the conditions of lack of socialization.
Yeah.
All of that doesn't present an easy picture. And the institutions like the society I belong to, the Psychological Society of South Africa, has been going out of its way to provide help to the public and to other professionals. Frontline workers themselves have been impacted. How they continue without the kind of physical and mental and psychological support is a miracle that they're still around. And we need to take our hats off to them because their service has been unstinting. Hope that our leaders can take a leaf off their book and do the same.
All right, we have to leave it there. A lot of concern. Hopefully the vaccine program gives people more certainty. But like Dr. Sachs Cooper says, a lot of implications could still hit us in terms of children. Thank you very much. He was president of the Pan-African Psychology Union.